Yeah, really lucky to have Dr. Natasha on, because I know that she's helped a lot of people with her guidance already. She did an MBBS from Karachi in Pakistan. She's been in the UK, started in Poole Hospital. I'm not quite sure what year it was actually, Natasha. I'm sure you'll tell us when you go through your story.
29.
Oh, there you go, 29. Fantastic. Currently a core medical trainee. This is an aspiration of many doctors abroad to get into core medical training. There's so much debate and talk about how difficult it is and how to do it, what's the right way to do it. You're going to hear all of that today in Natasha's talk. So she's currently a core medical trainee in East Midlands, and she's done lots of other things as well. And her future aim is respiratory. I wonder if that might change at some point, but that is her current aim in the future. So I'm going to hand over to Natasha. What are you seeing that we can see and hear okay? Natasha, I'm going to switch the screen onto your slides, and then we can get going.
So hello, my name is Dr. Natasha Javed, and I'm currently working as an internal medicine trainee year 1 in East Midlands. My talk is going to be about internal medicine training and how I have done it and how you can do it basically. So yes, I graduated from Sindh Medical College, Karachi in the year 2016, and then I completed my internship house job from the Jinnah Postgraduate Medical Center, Karachi in 2017. Then I started working in a cardiology hospital. It was in 2018. Then I started working there, and while I was working there, I took my IELTS Flap Part 1 and Flap Part 2 exam, which is the best part of taking Flap exam and pursuing your career in the UK, is that you can take these exams while you are working, and it's quite doable, and people have been doing that. Then I got my GMC registration on 15th of June 2019, and after getting the registration, I remember I sat for 2 days in a row and I just applied for all the jobs on the website of NHS, and I got 3 interviews within a week. All of them were medicines, mainly because I think my background of medicine. I was offered the jobs from all the 3 interviews I had, and then I chose Poole Hospital mainly because of the job description was entirely medicine. So I worked there from September 2019 till June 2021. I took 1 month off before I started my IMT. So it was almost 1.5 years I worked in Poole Hospital. So steps to internal medicine training. So guys, it's going to be a long journey, so you should bag yourself for that. What is internal medicine training? It's actually a training if you want to become a consultant, a medical consultant, like a nephrologist, a cardiologist, a respiratory physician, like I want to be. So you have to do internal medicine training, and it used to be of 2 years earlier, but now it's of 3 years. Which is good in a way that you get to be more mature before you become a registrar. So for the first 2 years, you will have 6 rotation teacher, 4 months with ITU and elderly medicine being the mandatory ones, and the 3rd year is going to be a transition year where you will basically learn how you will become a registrar. You will have 6 months of acute medicine and 6 months of your desired subspecialties. If you want, like I want to be a respiratory consultant, so I'll have 6 months of respiratory, which is good in a way. So, and also while you're working as a trainee in 3 years, you have to take all the MRCP exams, and you have to maintain a portfolio, and it's all about competencies. I know that exams are very important, but in the UK, I'm sure Dr. Aman and all the seniors would agree that it's mainly about proving that how competent you are, and you have to prove it with the competencies and getting yourself signed off with them. So pathway to the UK, I'll be very quick here. You have to take English language exams, IELTS or OET. I would recommend OET because obviously it's a very professional, it's like designed for the doctors, so it's good in that way. So you take PLAB 1, which is conducted globally, then you take PLAB 2, which is in the UK. You get GMC registration after that. Before taking PLAB 2, you should also get a course in the UK so that you can prepare yourself. I mean, people can do it without those courses, but I haven't seen anyone. You get GMC registration after that. You get NHS, you get into NHS, you do some time non-training job, you get your CREST form signed off. I gather that Dr. Aman has explained very well about the CREST form. I'm going to talk a bit as well, like I'm going to just explain how I have done it. It's a bit of a model to explain where I am at the moment. I'm here in the stage 1. I'm doing the IMT training, and if everything goes according to the plan, I would be able to start within the next 3 years my registrar, like the specialty training. I've added this diagram just to emphasize, if you want to become a dermatologist, a hematologist, or any of the subspecialties mentioned in the group 2, your training can be shorter. So you can have 2 years of IMT and then you can get into the specialty training. Otherwise, if you want to be a respiratory or a cardiology consultant, then you have to take 3 years of IMT. So how to apply? That's a good question. Obviously, it's round 1, which is advertised in November, and I think it's now closed. Application window is usually in the November, and it ends in the start of December. The dates are variable. There was no round 2 for IMT in 2021, and for 2022, I think they are still not sure whether it's going to happen or not. And they're going to advertise, if it happens, the leftover seats from round 1. But it's good that in round 1, everyone can apply. So it wasn't the case earlier, only the UK graduates could apply earlier, but now everyone can, and it's the best part, and I like it the most. That IMGs can apply, everyone can apply. And it applies to Oriel 2, which is the bit of a modified system from the previous Oriel system, and it's very nice and very self-explanatory system that you have to use to apply. Eligibility. So if you talk about the eligibility, if I talk about the eligibility, so it's mainly the CREST 2021 form, which you have to get yourself signed off with, and then the others, apart from ALS, comes automatically. So if you have worked 2 years in medicine, which I'm sure you would have if if you have done your house job in your home country, like I did in Pakistan, and then I had some time in Pakistan. So you need to have 2 years of medical experience, not necessarily medicine, but yeah, you should have experience. And then you should be taking a language exam, which you would have taken if you have got GMC registration. And your degree should be in English, and that I'm sure should be. And then the most important thing is ALS. It's very important for you to get your ALS done sooner rather than later, not only for the sake of applying for the IMT, but also if you're working in NHS and you are working as an SHO, you should have your ALS done, and you should get it done from the Resuscitation Council in UK. It's not ACLS. I know there are a few hospitals which provide ACLS in my home country, but those will not work over here. So get it done from Resuscitation Council UK. A bit of the model of the CREST to 2021 CREST form, which is I'm not going to go into the depth of details of these forms because that will take a while, but that's how it works. And if you're a good doctor, you're a professional person, you are reliable, you are very clear with your communications, I'm sure you would be able to get most of your aspects of your form signed off. But the important ones I've just highlighted for the sake of telling you what I have done in order to get myself signed off. So the ones which are like, the first one is to perform the procedural skills safely. So these are the basic procedural skills which you must have done in your home countries. I have done as a house officer. I was doing catheterizations, doing NG tubes and all. But you have to come here in the UK and you have to do it in front of someone who signed off to sign you off. And if you do them and you do them correctly, they will be very happy to sign you off. I got these signed off by getting into AAD for 1 week after finishing my shift at 5 p.m. And I would ask the nurses to do it because they're the best person who would be able to sign these off for you because they do them regularly. Yeah. And then talking about the cardiac and respiratory arrest. So this was the new addition in the CREST 2021 form. It wasn't there earlier. And they wanted you to have ALS, but they didn't want this main competency wasn't there. And when I was in Pakistan at that time, and I came back and I saw that, oh God, this is just now a new thing, and I didn't have the evidence. I was a part of some of the resuscitation cardiac arrest calls, but I didn't get those signed off at that time because it wasn't the part. So I did a few things. I spoke to my educational supervisor, you should do that too. And I told him if this is something I want and I want to apply for the training this year. He gave me a few ideas. I spoke to the switchboard. They gave, you can even do that for yourself. You can get a special bleep for yourself, which could be a cardiac arrest bleep. And if there is an arrest call, you will get a bleep and you will go there. You can also go to the board meetings every day and speak to the medical registrar early in the morning and tell them that, see, I want to lead one cycle. If you're happy for me to lead one, and would you be able to sign me off for it? If they say yes, that's good. Or if you can also, as an alternative, you can ask that if I write a reflection on it and send a ticket to you, and can you comment on how well I was and how I performed? And I'm sure they will, because people here are very helpful. They're always very, very welcoming. If you have something, some needs, obviously you need to tell them. And once you will tell them, they will know and they will definitely help you. But if you will not speak up for yourself, you will not. And I was also a part of the simulation or program organizer, as like I was organizing an IMG simulation training program for my hospital. So I made it a part of the curriculum when I was leaving, so that the other IMGs could benefit from it. And I did organize the same for the current IMGs, even though they were not willing to apply for the training that year. But I told them that, come with me, let's do it together. Maybe it's going to help you later on. So so you can do such things for yourself. You are the part of the system, and you can take the responsibility to make some changes which could benefit your other IMT colleagues. Talking about the QIP, that is another aspect of the CREST form, which you have to be proactive. You have to be very proactive for. What QIP is, it's actually if you are not happy, if you think that there's something which you can change in the system, or you think that, well, this should not be working like this. So what you can do is you can assess and analyze, and then you can say that, well, I analyzed that this particular thing should be done this way, but only 40% of the people are doing it, and I would like to educate people and bring some changes in an improvement in the quality of care for the people. And it is something which is not very common it wasn't common in my home country. And to be honest, this question was asked to me when I was giving my NHS non-training interview, and I did tell them that, well, this is not something which I have ever done, but I would really like to be a part of one so that I can know that how it works. And I know that my consultant who was interviewing me was very pleased with my answer. So you can obviously try finding out ways to how you can bring qualities improvement and the improvement in the provision of care to the patients coming to the hospital. So obviously, when you that all is done, I've discussed about the CREST form. But when you apply for your job, so you have to fill in a form on the ODL2 website. It has got a few aspects. So you introduce yourself, you tell about yourself, your background, and from where you are and all, and your achievements. So be very, very clear about your achievements, and don't be modest. So don't think that if you have done something very small, or that seems to be very small for you, so you think that, oh, every other person is doing it, so you don't talk about it. Talk about it. It's important. QIPs, like I said, so you have to do it. Leadership. If you have been in a leadership role, you can reflect about it. If you have had any presentations, you have presented anywhere, you can talk about it in your written application. And then if you have done your MRCP and how committed you are to this medicine, and that you can obviously say by, if you know that what you want to be by coming to IMT, and what's your long-term plan. So talk about those things in the portfolio. So don't be, I was a bit lousy when I was filling this application and I missed a few things. I could have scored even more if I would have talked about myself and have been open about it. Don't be modest. So I'll be very quick over here. I will be taking you through about with the scoring system. So if you have got any undergraduate degree or any BSc, which is very common in the UK, and if you have one, you can score yourself for that. If you don't have, don't worry, I will have one. If you have any postgraduate degree like a PhD, and I've copied all these from the IMT website, so yeah, it's not changing anytime soon, I'm sure. So if you have got a PhD, an MD or MPhil, you can score yourself for that. You can not score yourself for MRCP, a very commonly asked question. Yeah, so I am MRCP doesn't count, guys. So I scored 0 there as well. So presentations, if you have presented anywhere, if you have been, if you have presented any case or any of your research work or oral poster presentation, you can score yourself for that. If you have any teaching experience, if you have organized a teaching curriculum for any hospital or anything, you can score yourself for that. If you have been teaching medical students, you can also score yourself for that. And if not, then do some. If you're working in a non-training SHO job, you must be having medical students coming. Do that and get a feedback form and just score yourself for that. Training in teaching, obviously, if you have a qualification in the teaching, you can score yourself the maximum, but the minimum, I think, is to attend a teaching course. It's a very popular course in the UK, Teach the Teachers or Train the Trainers. I haven't attended. I don't know why I was not able to attend this course. I've got other things going on, but you must attend one and you could score yourself for that. QIP, yes, try to do QIP sooner rather than later. If you can do like 3 cycles, I can assure you that if you speak to your audit department in the hospital, they will be very helpful, and everyone in the UK is helpful. They'll help you with that. If you have been in a leadership role, score yourself for that. Even if you have been a clinical group leader in the 3rd year of medical school, I'm sure you must have a very rough time over there collecting grade books and all. So that's the time you can earn some reward from it. And if you have published any of your research work, if you have done a research work is a part of your curriculum in the 3rd or 4th year of medical school, like I know it's very common in Pakistan, it is mandatory. So you can also score yourself for that. And if you published it, score yourself for that. Coming to this graph, this was the email which was sent to me when I was shortlisted. So the scores that I just mentioned, you know what the total number is. It's 54 score in total that you can score yourself out of 54. That's what I mean. So if you have done even more, so if you see the minimum number, I was actually shocked to see that the minimum, like the average score was 17, and the maximum number we're scoring were like 17 only. So I thought my score was low, but that wasn't the case. I think the maximum number of applicants are scoring on the lower end, and I can see like there were a few who were scoring in 40s, but they should be really great. So after you're shortlisted, you will get an invitation to the interview. In my year, unfortunately or fortunately, there were no interviews. We were actually shortlisted, and we did receive an invitation for the interview. But then, because of the second spike, they all were cancelled. And what I know about interview, I cannot obviously I don't have an experience, but I can tell you that there are 4 stations. First is the ethical. For example, you can get an angry father who is not happy with the management of the patient, so how you're dealing with it. Clinical case, so always make sure that if you're given a case, answer from A to E assessment. Never say that, oh, I'm going to start this patient on IV antibiotics. Notes. Start from A to E, A, B, C, D, E assessment, and that is what is very well received and obviously very much appreciated by the consultants in the UK, no matter if you are not telling a very great management, but you are following the protocol. Suitability and commitment, that would be a 5-minute station, so they would assess you about how committed you are to the specialty and your background, and they would be actually asking you why IMT, why do you want to pursue IMT. And then application and training would be mainly about your portfolio, and you should be having a portfolio even if you are having a non-training job. And if you're not having one and you are in a non-training job, you should be doing the first thing you should be doing on tomorrow is to call your education center and ask them for a portfolio, because I know there were a few of my colleagues who were not having a portfolio. And if you are not having one, so you can pay and get a portfolio, but have one. So this is contingency plan. So this was the backup plan for if there was no interview, and I'm sure this is one of the things which could happen this year as well. Nobody can predict anything. So because after this plan, so I was asked to upload the evidences, and then my documents, including the awards and the certificates and everything I received, I send those evidences to they send those evidences to the deanery, and the deanery assigned a consultant who assessed and assessed my score. So you could be underscored, like they say that, well, this candidate has underscored themselves, so then you will receive an outcome that your scores are increased, or they might say that you have overscored yourself. My score remained the same, so I didn't yeah, so that was okay. And then obviously commitment to speciality, they will see and they will rank you on that. So as I mentioned earlier, that I was a bit lousy, and I was filling out my application because I was thinking that we are going to have an interview either way, but no. So they read my application and they scored me on that, and so I could have been a more I could have, I could say that I could have sold myself even if in a more better way. And it's all about selling yourself. If you're telling that how good you are, how madly in love you are with medicine, and how much you want it, then obviously you can speak about. I did spoke about my skills, and I did tell them that I stayed overtime and I tried to get that competency signed off, and I wrote all that in the application form. And I thought that I'm just writing it, nobody's going to be bothered about it. I mean, but then when I received the outcome, I saw that the consultant who saw, obviously assessed my application, was very happy with the way I've done things. Teaching and QIP, obviously, they will be scoring you for that. So the process in a nutshell: so you submit the application by the end of November, then you will receive a confirmation email that, oh great, you're long listed in 2 weeks. Then you will receive an invitation and that you're shortlisted by the end of December, and that would happen if you are falling on the left side of your scoring. Your average score is good. Uh, uh, as compared to the applicants who have applied this year. Then if there is an interview, you will be going to the interview. If not, then you will be following the contingency plan. Once you receive a confirmation that, okay, so now you can choose your preferences. So you can choose your preferences according to what you want or where you are willing to stay, and then you will receive an email saying that congratulations, you're selected. You can accept with upgrade, or you can reject. I accepted, but I didn't accept with an upgrade, which is a mistake. So I'm sharing my mistake as well. That's okay. I've learned from it. But you should accept with upgrade, because if you accept with upgrade, there are very much chances that you will get a more better position. So yeah. So if I tell you about my little bit of my journey, it's like it wasn't easy in terms of specifically in terms of the kind of person I was. I was a very shy person. I should be like, I could say that I used to think like about thousands of times before asking a question and before even just saying something in front of anyone. And when I came to NHS, I remember that there were days when I used to stay quiet, when I just quiet, not saying anything, and trying to understand what's going on, where I am, how things will work, how will I survive and all. But I had obviously some of the unexpected situations that I faced, but obviously things will not go according to how you will plan. But if it doesn't, it's okay. It can happen to anyone, and just stay there and keep going. I really like to thank my parents. Obviously, I lost my father last year, which is why I went to Pakistan. And when I came back, obviously the stress form was another challenging situation for me. So because you won't be able to see them anymore, it will be even more when you are here in the UK, you don't get to see them, and obviously you will keep missing them. So when you are there in your home country and you are not getting your exams cleared on time, or you are struggling with IELTS or OET, just enjoy in present and be just take that time as a bonus that you are able to spend some time with your family. And I'd like to thank all my family. My husband, I've just got married this year, and my in-laws to be that they've been very supportive. I do miss them, and because I'm on my own in the UK. But yeah, that's it from my end. I hope my presentation was helpful, and if you have any questions, you can ask.
Wow, Natasha, thank you so much. Natasha, that was that was a great talk, and not just great because you covered all the necessary things that people ask about and talk about and all those common questions. You covered all that really well, really succinctly, but it was done with your story in mind, and you know, that ending was just testament to that, really, and it just shows the sacrifices and you know, all the challenges that the doctors have to go through alongside training and application and exams and all that kind of stuff that is hard enough anyway. So yeah, thank you for that. Yeah, really great talk, and a lot of comments and coming in, people saying thank you, very helpful. You know, lots and lots and lots of positivity coming back there. So thank you so much, Pooja.
Yeah, absolutely. Thank you, Natasha, for taking time out to do this talk.
It was a pleasure.
Yeah, really insightful, and thank you for being so candid. It's not often, and it's not easy to share your experiences like you have, and that will be a great source of motivation for many of our attendees today. In fact, we can see it in the comments how much they've appreciated you sharing your journey with them. Just a few questions, Natasha, if that's okay.
Yeah.
This has come through, so. Amazing talk, Dr. Natasha. I'd like to know if living alone while doing a non-training job is favorable. How challenging was it?
Yeah, so like I said, it was really challenging, and some days are good, some days are not, and some days you feel you are not, you are in a wrong place, or why you are here, you should go back. But it's all about being positive and you know, being looking at your final ultimate goal. So if you focus on that, I'm sure you should be able to overcome. If you should not just stop dreaming, and you should not just quit. That's the main thing I'd say. Yeah, and living alone is not an issue. It's not an issue, as in not in terms of safe. I mean, especially in terms of safety. So it's all safe over here. So don't be worried about it. I have no relatives in the UK, nobody. So at 10 o'clock at night, I landed in the UK for my Plat 2 exam, and I didn't know anywhere to go. So that's okay, guys. Yeah, don't worry. Just keep your hopes up.
Yeah, and it's people who've been through it that is important for people to hear that. Definitely. I've done it and you can do it, and you know, it's great to hear.
Yeah.
Great to hear. It's a couple of questions. How can one obtain a formal teaching feedback form, and how to get a portfolio if not yet in the UK?
So if you are not yet in the UK, then obviously wouldn't be very. You should be in the UK to get a portfolio, because they want the people who can sign you off for the competencies to sign you off for the UK. And what was the next question? Sorry. So was it because
it was about the feed? Is there any particular feedback form that you use for teaching? A
yes,
formal?
so you can, yeah, definitely. So you can Google and you can write the GRCP teaching feedback form, and then you can download it as a PDF, and then you can get it filled in written, scan it, and attach it to the portfolio. That's what I did.
That's great. Does medicine core training have an age limit? I know the answer, but you can answer, Natasha.
No, there's no age limit. I have seen a consultant. Sorry, I've seen a doctor working with me in A&E last week, one of the night shifts, and he was 40 years old, and he attended his graduation. So you know, yes,
yeah,
no.
Yeah. At one of our MRCGP AKT courses a few years ago, we had a doctor turn up who was, I think, 66,
Yes.
and still in training. So age is no barrier.
Nope, not at all.
That's great. There are lots of questions actually coming in. A lot of comments, but a lot of comments attached with questions. So are you okay, Natasha, if we forward these on using the system? And then
that would be, if you forward it to my email.
We can just do it, and it'll just be on the screen. So we'll transfer the question across to you now, and then you can just reply and
Okay.
and tell them to email you whatever's best.
So can I reply them here if I can? Then?
Yeah,
Okay.
you can. Yeah, we'll just forward them on. Once we start the next talk, we'll forward all of these onto you because they're quite specific, and I think some of them are about your experience as well. So
Okay.
it'd be good to get them. But yeah, thank you so much once again. Really, really helpful, and yeah, I think it's going to help a lot of people. A lot of people.
Thank you so much for giving me this opportunity. Thank you.
Thank you.
Bye.